Lawrence, Doctor of Nursing Practice, and I just wanted to jump on here real fast and talk a little bit about this coronavirus, since I know we are all now touched in some way by the coronavirus here in the United States. And I just wanted to say that there is a lot of information that you can be getting out there with the media. And I am looking at the CDC for my information, and according to the CDC, what we do know about the coronavirus or the COVID-19, that people that do contract COVID-19 have probably a worsening outcome if they are older or if they have underlying chronic conditions. It is spread through respiratory droplet that we, through sneezing or coughing those droplets out. So we just need to obviously make sure that we are washing our hands diligently for at least 20 seconds and doing it regularly and often. Also, trying not to touch our face, staying at home whenever we're sick. And at this point, we probably should stay home and try to social distance ourselves as much as possible. So when we do have to go out, then we should try to avoid, hand contact. So avoid shaking hands and try to stay within 6 feet of people. We know that the virus is more easily spread with closer contact, so within 6 feet. And we should, really try to decrease the spread of this virus so we can, not overwhelm our healthcare system and try to give us the, most fighting chance when it comes to this virus. I'm sure the more immunity we get to this virus, it will become less and less of a concern. But for now, since, it is a pandemic and we do not really have the immunity we need for COVID-19 and there is not a vaccine at this time, our best protection is to wash our hands, to not touch our face, to stay at home if we're sick, and to wear a mask if we are sick and we are going out. So if we had to go to our doctor's office or something, wear a mask. And also, you do not need to wear a mask if you do not have any symptoms. At this point, we do think that people probably can spread the virus or pass it along without symptoms. So that's why staying at home and social distancing ourselves is probably what is, best for now. And the symptoms of COVID-19 are respiratory symptoms. So the patients or people will experience fever, cough, or shortness of breath. And mostly you should call your doctor's office if you are experiencing these symptoms before going in. And if you really are experiencing a lot of shortness of breath, then you should go to the hospital to get checked out further. We are, getting our testing going here in the United States, but most of the testing was being done through the health departments with, very strict reasons for patients to be tested, which a lot of those reasons are still good and valid. However, they are lifting some of the restrictions on testing now, and there are some other laboratories that are starting to test, and there are some drive-through laboratories that are starting to test. So we will know, as we go along, how many, we will know more cases of COVID-19 as we go along, because we will probably test more. But for now, most people will get over the virus, so just try to stay at home if you're sick, and even if we're not sick, try to practice social distancing, and we should get over the virus just fine. So I hope all of you guys stay safe out there, and if you are working in healthcare, I hope that you guys are getting the guidance that you need and that you stay safe there on the front lines.